How are you? Put your questions in the box. Remember, we will answer the questions afterwards. Josh, if you'll check the chat in case people are having some trouble logging in or have some questions. Okay, so the plasma pen, as you know, is a relatively new technology that has come to the US. There are many different brands of pens, so I am not touting one pen over the other. I do train on the plasma lift. Right now, I train only one-on-one classes because I just think that that's safer. So that's what I do right now. As far as insurance and scope of practice, again, I have a spa, so I don't do it at the school. I do it in the spa, in the skin clinic, and I have a medical director. So it's covered under the medical liability insurance that I have. So again, you know, there's so many gray areas in what we do, and the technology is moving really quickly. I do know that ASCP does have an advanced esthetician liability insurance. So again, if you want to ask them, I know it does cover microneedling. I'm not sure about plasma lift. But regardless of whether you do these technologies or not, I always say one thing, that your clients are reading. Your clients are reading the information and they know what is out there, right? They see this on YouTube, they see it in magazines, they see movie stars and influencers doing these procedures. And so they want to ask you, the expert, what is it all about? So it's important that you know. I will also have another disclaimer, as you know from all of my webinars, I have 2 little dogs and they're not in the crate, so if they bark, I apologize ahead of time. Max and Louie are with me today. All right, so plasma skin regeneration, plasma lifting, plasma pen, like I said, is a new technology that is going to help create a thermal effect, lift and tighten the skin, and it's almost instantaneously. This is for Fitzpatrick 1 through 3. 3 with caution because they may be a 4. You know that from laser technology, correct? So it's different from lasers and light sources and ablative lasers, all right? Because it is not light dependent, it is not chromophore dependent, and does not vaporize the tissue. But it leaves the layer intact, all right? And it serves and forces the skin's natural healing process for rapid recovery. So in anti-aging, or what we like to say now in prejuvenation facials, we are always relying, whether it's lasers, microneedling, dermaplaning, lasers, we are in advanced chemical peels, we are asking the skin, we are asking the body to heal itself, right? Even when you have facelifts or plastic surgery, your surgeon is relying on your body to heal itself, because if it doesn't heal, that's when we have problems. Why am I saying this? I'm saying this because you need a client that is a healthy client without autoimmune disorders and is 1 through 3. So this is not for your olive to dark skin tones, okay? It is beneficial for photoaging, skin laxity, and acne scarring, all right? Okay, the most dramatic things that I have seen is the eyes. Besides surgery, I don't know what you can do on the upper and lower lid. So this is fantastic. The results on the eyes are dramatic and incredible. Now, if somebody has skin laxity, like the lady on the right, the upper eyelid, then I would say you need to do 3 sessions, all right? So it is the skin tightening technology that harnesses the power of plasma, sounds sexy, not to be confused with vampire facials, right? Not that type of plasma. The 4th state of matter, solid, liquid, gas plasma, to help reduce or eliminate certain skin conditions and concerns, such as wrinkles, fine lines and wrinkles, skin tags, etc. So it's effective for periorbital rhytids right around the eyes, also non-facial sites, hands, neck, chest, stomach area, stretch marks, minimizing the appearance. So there are different protocols and different energy levels that you can adjust the control, right, to the degree of intensity. So that's what's awesome. You can really be very, I find that I'm a little bit of an artist with the pen. I will say it's not comfortable. I use numbing, it's still painful, especially because the forehead is very thin. I know some doctors give clients painkillers because it's really that painful. It just depends on the client's pain tolerance level, all right? All right, so we know now that the plasma device uses plasma, the fourth state of matter. It is a gas-like matter which is composed of ionized atoms. Ionization occurs when sufficient energy is applied to the gas so that electrons can escape from the atoms, leaving the atoms is a positively charged state. When the electron is recaptured by a positively charged state, energy is emitted or stored through the vibration and rotation of gas molecules. Nitrogen plasma releases its energy in the form of heat. So I just kind of think of it like welding almost, you know, or cauterizing is really what you're doing. You're cauterizing the area with thermal energy that is channeled to the target. So it's important just to understand collagen, because what's incredible about this device is that they're going to see their skin improve 3 to 6 months, even a year after the treatment. Some people will need 1, some people will need 3, 6 to 8 weeks apart, right? They're going to see incredible. And I've had really good fun with this. If your clients want to shrink the pores, I always said we're not opening and closing doors on the pore, but the nose area, I do my dots, which I'll explain to you a little bit later. Oh gosh, I wanted to get a pen and paper and say something else to you, but I'll get that in a minute because I totally forgot. Okay, so collagen remodeling type 3 collagen replaces a thicker and stronger type 1, forming tight cross-hatching with other collagen fibers after 14 to 15 days. This process continues through days 20 to 21. The new skin integrity lasts for several weeks to several months. Collagen production normally peaks after 6 months. So they're going to see immediate results, then 3 to 6 months, they're going to see even better results. Okay, what is plasma lift, right? So an example of how a device works is by creating a pulse of ultra-high radio frequency energy from the device generator that subsequently converts nitrogen gas into plasma within the handpiece. The plasma emerges from the distal end of the device handpiece, immediately transferring the stored thermal energy to the skin's surface. Every pulse of plasma energy released into the target produces uniform tissue heating. All right, so this minimizes the risk of unpredictable hotspots, charring, and scar formation because you don't really touch the skin, you pop, pop, pop. This process exhibits a very low thermal constant, so it is virtually instantaneous. The handpiece does not come in direct contact with the skin. All right. In contrast to ablative lasers, plasma resurfacing leaves a layer of intact, desiccated epidermis that act as a natural biological dressing. So that little scab, think of it as a biologic dressing and promotes a more rapid recovery than would be observed with ablative treatments. Plasma lifting is by definition non-ablative, not chromophore dependent, and rapid thermal penetration of the skin produces zones of thermal damage and deeper zones of thermal modification. So again, think of aerating a lawn with that fractionated device, but you're using it with the fibroblast, but you're having that crust to protect the skin. The desiccated skin, that little scab, sloughs off over the 4 to 5 days. So that's why we call it social downtime, right? And it is safe to use on Fitzpatrick's 1 through 3. All right, what is a plasma lift? We talked about that again. We are using thermal energy to apply those dots to the skin, right? So this thermal disruption of that yellow thickened skin as a result of some damage is activating the skin's own fibroblasts and stimulating wound healing basically, all right? Immediately after a high energy treatment, an intact and non-ablative epidermis is visible for 4 days after treatment. So you're going to have those little dots for 3 to 4 days, then they're going to start to fall off on their own. We don't want them to pick at them because those dermal remnants serve as a biologic dressing to protect the skin from infection, all right? So it's little pinpricks, but that they have scabs, and you will see immediate tightening. 10 days after treatment with fully regenerated epidermis is visible, and continued collagen production are observed for up to 1 year after treatment. What are the advantages? No cutting of the skin, no stitching required, low risk procedure, minimal side effects, short downtime, quick and easy procedure, no thinning of the skin, and cost effective. Indications for treatments: non-surgical, eyelid, upper and lower, skin tightening, skin tags, stretch marks, wrinkle reduction. I love to zap those cherry angiomas, and of course hyperpigmentation as well. Client consultation. We do a Precare intake form. If you are displaying any signs of cold or flu, the treatment needs to be rescheduled. Contact lenses must be removed when performing the treatment on the upper eyelids. Skin should not be inflamed in the area we are treating, right? So I have a client, sometimes she likes to pick at her skin or do her own extractions, and I had a lot of scabs and open lesions, can't do the treatment, all right? Any open lesions like herpes simplex on the upper lip, can't do it, all right? Skin should not be inflamed in the area we are treating prior to the procedure. If you have sunburn or suntan, treatment should be postponed for up to 8 weeks or until the tan or burn disappears, right? So they're going away on vacation, we can't do this. You come back, we wait 8 weeks, and then we'll see. Discontinue any use of AHAs or BHAs or retinol skincare products for 4 weeks prior to the treatment. Eyelash extension receiving upper or lower eyelid treatment must have lashes removed prior to the treatment and reapplied after 8 weeks. Discontinue use of any cleansers, creams, or serums containing salicylic acid or glycolic acid, lactic acid, 4 weeks prior to having the plasma lift skin tightening procedure. No Botox or fillers 3 weeks prior and 3 weeks post. Discontinue the use of Latisse 1 week prior to the treatment if having upper eyelid or lower lift. So we want to do a thorough consultation, an informed consent, a pre-care, a post-care, and follow-up and touch-ups. For example, a client sent me a picture. It looked like I went down one side, not far enough, on the upper lip. And she sent me a picture, and I said, don't worry, let's wait the 8 weeks, and I can do a touch-up. That's what's so nice about this, because also, as you know, just as eyebrows are cousins, not identical twins, the same thing with the face and the facial structure, you're always going to have one side of the face slightly different. For example, I had Bell's palsy on my left side of my face. So in pictures, you'll always see me when I'm smiling, the right side goes up a little bit further. So, you know, I really look at the face like an artist, and I'm going to be able to show you some really cool pictures in a minute. All right. Make your client aware of social downtime, right? She's going to have dots on her face for 3 to 4 days. Okay, so sometimes it's nice if they don't have plans for the weekends to do it on a Thursday, because by Monday the dots would have fallen off. Skin will be red and sensitive for a few weeks post-treatment. So I buy the boxes of small Aquaphor, and they come in like 2 in a box, little tiny ones, little baby ones. And I use it afterwards, and I give it to them to use because it makes the skin feel wet and pliable. Also my HA serum as well, so that the skin feels moisturized, but we're not putting in any chemicals into the skin, all right? Full healing that will last, will take about 6 weeks, okay? And then if they want another one, I like to wait 8 weeks. Okay. So we have some contraindications. For darker Fitzpatrick scale, well, this is not for you. We have other things that we can do. I would say the skin laxity, though, is usually in your fairer complexions anyway. If your skin is prone to scarring or keloid scarring or hypertrophic scarring, if you have severe acne or if you have immune disorders, then we have a problem there. If you have allergies or sensitivity to any products used during the treatment, we are going to use numbing. So if they have an allergy to lidocaine, you know, I don't know what else to numb with. So, you know, that's a problem. And it's going to be painful. If they're on blood thinning medications or been taking Accutane in the last year, if they're pregnant or breastfeeding or immune deficient or have autoimmune disorders, if they have metal pins or plates, because we are using an electrical treatment, if they have blood clotting disorders like thrombosis, cardiovascular conditions, pacemakers, bleeding disorders, or malignancies or chemotherapy the past 3 years. So those are sort of normal for your laser, any type of your pre-rejuvenation or anti-aging type skin resurfacing treatment. So nothing unusual there. You really want to have a thorough intake form and have a discussion with them and have enough information on your website, because, you know, I like my client to be an advocate for themselves, and I like them to realize, are they a candidate? Sometimes, you know, they want to have their whole face done, and I'll say, let's do one area. Let's see if you like it. If you like it, I do more. You know, I want a happy client, right? They are expensive services. I want my client to be serious about these services. I want them to be compliant with post-care. And, but really, I haven't had any issues except for the one client that said that I didn't go further enough down her upper lip, which I'm going to fix, no problem. Because I'm really not looking at the evenness of what I'm doing from one side to the other, because remember what I said to you, both sides are different. So I'm looking at my lifting, so the client's not seeing what I'm seeing, right? So it's very important to check the contraindications and to make sure that they are a candidate, right? And then also, what services are important and do you need your general practitioner to sign off? So we talked about really, you know, contraindications, so any autoimmune disorders and diabetes and cancer and anything that may prohibit, and also any photosensitive medications, because we are using electrical. And so again, anything that's going to thin the skin, high blood pressure, medications, pregnancy, breastfeeding, fever, epilepsy, liver disease, any disorder that's going to affect the body's ability to heal. So just a review of the things that we're looking at. So when I do the procedure, I take any alcohol off, alcohol spray, my hand sanitizer off my cart. Because you may not think and reach for your spray bottle of alcohol, reach for your hand sanitizer, because alcohol and electricity are not friends. So to degrease the skin, I use a witch hazel. I don't use an alcohol, okay? I'll cleanse the skin twice with a gel cleanser, and then I'll use my my degreasing agent, which is usually a witch hazel, okay? Just a non-alcohol based degreaser. So that's because we're using electrical current. I take before and after pictures. When we end this, I'm going to show you a couple of things that I do, because I was going to get a piece of paper and a pen and I forgot. Okay, medical history should be carried out. Before and after pictures should be taken and saved. They must sign a release to take the before and after pictures. Okay, some possible post-treatment reactions. Following the treatment, their skin will feel like there's a sunburn. They will feel tight. The eyes can swell. So, you know, I've had people that I've done their upper and lower lids and they don't swell. Well, I did my eyes, my upper eyes and my lower eyes Thanksgiving last year because, you know, I thought, okay, my daughter's an esthetician, so she did it on me because I can't do it on myself. I'm like, oh my God, it's like, I couldn't cause myself pain. I was like, no, I can't. So, you know, of course it's Thanksgiving, we're sitting around the table, and of course I'm gonna have my wine and my champagne, right? Good, of course. So like my eyes, because alcohol, my eyes were like puffing and swelling up. My family were like, oh my God, Elaine, are you okay? I'm like, I'm fine. So just a hint, no alcohol after eyes. This is my fruit water that I love to make on the weekends. So no alcohol because but then I did some clients' eyes and they didn't swell up at all because the eyes are kind of hydrophilic. So they will swell and crust over, okay? So depending on skin sensitivity and pain tolerance, right? Some may last longer than others. I also give them an ice pack. I buy like little square ice packs and I cover them with my aesthetic wipes because I don't want to put ice directly on the skin, and I let them, so they go home with their mini Aquaphor and they go home with their mini ice pack that I give them so that they can use that and then they can refreeze them. Because I don't want them to use ice directly on the skin. I want them to, cover it. It just makes it feel more comfortable. And then the Aquaphor makes the skin feel pliable and wet, even though it's not, you know, hydrated. So, because obviously I want those dots to fall off, okay? So there's a light crusting of the skin, all right? They must not pick at them, and they'll drop off, all right? That's important. And the skin will just look fabulous afterwards. It's really fantastic, all right? Do not wet the area for 3 days. I don't want them to put their face on the shower. I don't want them to wash their face for 3 days, okay? Except for the Aquaphor, all right? To use gloves or a Q-tip because I don't want them touching their face. The other thing is I give them 2 alcohol pads to wipe down their sunglasses and to wipe down their phone because I don't want, they may wear readers, they may wear sunglasses, they may wear glasses to read because I don't want them to put their contact lenses in. But, you know, I want to make sure that they're wiping down their glasses because we forget how much bacteria can be on our glasses and on our cell phones, right? I say don't wear any makeup for 3 days, and then mineral makeup is preferred for 7 days after that, from my personal opinion of what I've done. And then ice packs, like I said, is good, but I wrap the ice packs, let the natural healing process take place. So for 12 hours, no makeup, no saunas, no Botox, no sun exposure, no sunbeds. It's a no-brainer. You gotta tell your clients, right? They don't want to go exercise and then have sweat and heat on their face. So try and get them not to exercise for 48 hours. No swimming because the pool can have chlorine, bacteria, viruses, all kinds of stuff in it. Don't use any anti-aging creams that has those retinols in it. No AHAs, glycolics, and do not use exfoliating products. We want to wait for full healing, okay? I always say on the face, after 3 days, please use chem-free SPF. And then until I really would prefer you to wait for the dots to fall off to use SPF, quite frankly. But if you have to, wait 3 days. And then I like serums because that also makes the skin feel hydrated, especially my HA serum. All right. When you're prepping the skin, remember I talked about you should be cleaned with a non-alcohol cleanser. And then I use a witch hazel. You can mark the area. So on the stomach, sometimes I like to mark the area so that I can make sure I do, like I use a white pencil to make sure that I have my one side and I'm going in the area that they want, around the belly button. So the regeneration works immediately and works on excess skin. So I had a client send me a picture of their eyelid and there was a lot of drooping. So I said to her, you know, I really think you should go see a plastic surgeon because in my opinion, you know, when the upper lid is really touching the lower lid, I'm not going to be able to get that much excess skin tightened, if you know what I mean. When you're dotting, work either side of the fold and not in the fold. I'm going to explain that to you a little bit later. We'll get back to that. Okay, technique. All right. So I apply a numbing area. I cleanse the skin with my gel cleanser. I degrease the skin. There's about 15 to 30 minutes of wait time for the numbing to work. So my suggestion is give them a CBD décolleté massage, because that'll also help relax them. Or if they don't agree with CBD, then just a nice oil massage or massage cream. And I just give them because we are in the spa environment, right? I always say results-oriented treatment within the spa environment. They will feel some heat. Also, I cover the area with saran wrap, the area that I'm working on. I cover with saran wrap to kind of occlude the numbing into the skin. And then you can take off just where you, and leave the numbing on other areas, like, you know, the forehead and the eyes are pretty thin, so maybe you want to work on the other areas first. And they'll feel a burning sensation. I wear my mask, I wear my gloves, and I wear my scrubs, and I wear my face shield. All right. So here's one of my clients. So this is what I mean about getting creative. So I looked at her face and I felt like she needed a brow lift, and she needed the upper and lower, and what I call the bunny lines, which are in the upper nose by the glabella, and obviously the nasolabial fold. So we don't go in the line itself. We go either side of the line. And you do it I do it in rows of 2s or 3. So there's different methods, and I'm gonna get my paper we end with this, and I'm gonna explain to you. There's the 5-dot method, there's the straight line method, and then there's of course the spray method. Okay, so this is the straight line method, and then you can see I did a 5-dot method above the brow to lift the brow area. So nasolabial fold, bunny lines, upper and lower lid, and brow lift is what this client got. This is the plasma pen that I use. I recommend that and I use disposable acupuncture needles, and I recommend that you practice on oranges. Your 5-dot method, your spray method, your lines, that's a great way to practice to get used to your methods. Practice, practice, practice. This is working on the stomach area, so sometimes you may need to use a tongue depressor or stretch the area where there's loose skin so that you can get your 5-dot method, because sometimes there's a lot of folds. So we're not going inside the line. So, okay, so on Margie's face, you can see I'm working either side of the lines, and I have to really concentrate. The other thing I do is I always tell my client, with dermaplaning, microneedling, plasma lift, if you need to cough or sneeze, please let me know, because, you know, I do have a device in my hand. If they need me to stop so that they can breathe, I cannot feel their level of pain. If they need me to stop for a minute so that they can take a breath, that's fine. And then with the stomach area, you can see that there's, on the left-hand corner there, I put some dots on her stomach with a marker, so I knew exactly where I was going to stop my plasma lifting. But sometimes you may have to also spread the folds apart as well. So this is what I mean. You're not going to go inside the wrinkle. You're going to go either side of the wrinkle. In the stretch mark, you go inside because you're trying to close it up. But on the wrinkles, you're going either side. What to tell the client before the treatment? Wait until all the scabs have fallen off. So when you've got the numbing on the skin, you've really got time to talk to your client, right? You, of course, can give her the, you know, I give her the post-care, but I also have 15 to 30 minutes, I massage the décolleté, and I have 15 to 30 minutes to really discuss And yes, you can do LED afterwards as well if you have time. If you want to put some LED on the face, that's absolutely fine. You have a panel. Wait until the scabs have fallen off, although the clients can resume their activities immediately after each session, except for, I would say, anything that makes them sweat. They will not look their best during the healing process, which can last up to 7 to 10 days in normal circumstances. The area treated must not be covered with any type of makeup, mascara, or creams other than the product, which is the Aquaphor that you've given them. They can wash gently twice a day. That's after the 3 days, okay? And I prefer mineral makeup. We don't want them rubbing or scrubbing those dots. The treatment could be uncomfortable for the client, therefore numbing products shall be used for ease of treatment and comfort reasons during the eyelid tightening procedure. Swelling will occur 1 to 3 days. Like I said, I swelled up like crazy, but I've had clients that have not swelled up around the eye. So everybody's healing process is going to be different, all right? But it's always important to make the client aware. Eyelid tightening brings about a cumulative minor improvements of the appearance of sagging or drooping eyelids. Do not promise dramatic results, which can only be accomplished with surgery. Remember, I told you I had a client that came to me. She sent me a picture. It was really drooping. It was really the upper lid was on the lower, and I was like, I really think that you're not going to be happy with the results that I'm going to give you. So I needed to be honest. Now, I think this is great for people that have had eyelid surgery and they're starting to age, because nothing is permanent, right? Except for taxes and death, probably. So, you know, even though this and surgery is pretty permanent, but you're still going to continue to age. So if you have a client that maybe 10 years ago had an eyelid surgery, she doesn't want to have another one because she doesn't want to look crazy. This is a great touch-up for eyelid, for, you know, people that have had surgeries years ago and don't want to do another. So that's a great idea. Stretch mark and sagging skin, however, several treatments may be required. So remember I said to you that you may need to do at least 3, but you'll know. I don't know how many the client will need. She'll know 6 to 8 weeks how she's looking. The other fantastic thing is the nose with enlarged pores. I do rows on the nose, and that just seems to tighten them up. Sometimes I add that on for free, especially when clients are doing like a lot. I'll do an add-on for complimentary with that. So just so you know. We talked about this, but you know, I just have to keep reiterating to my clients, you know, wait 7 days before applying sunscreen. Wait 3 days before cleansing your face. Don't rub your face. Your skin needs to fully heal. Don't do any exfoliation or any HA/BHAs for 8 weeks, right? No heat and saunas, no running for 48 hours, all right? Clean anything that's in contact with your face. We talked about that. Glasses, phones, etc. This is the neck area. You can see that's before, that's during, and that's 8 to 12 weeks afterwards. You can see how dramatic and how fabulous this treatment is. And it just the smoothing of the skin area, it's amazing. Does it last? The results are permanent, although it does not stop your natural aging process. You should still see lasting results for years as they would with cosmetic surgery. For longer lasting results, you should maintain a healthy lifestyle, avoid smoking, excessive alcohol consumption, and prolonged sun exposure. So we want to avoid the treatment if you're nursing or if you're pregnant or planning to be. I don't advise it for darker skin types 1 through 3, all right? Because they are at higher risk of hyperpigmentation and hypopigmentation because we are causing trauma to the skin. All right, here's some ideas of pricing that I think is a good idea to charge. You know, I think it's a good idea. You know, the thing is that I will never put this on Groupon, just to tell you, because you can add value to your client if they buy more than one. But I want people that are serious and are compliant with their pre and post care, right? And I'm also not going to devalue. right now at my spa, I am doing 40% off all my services because of COVID-19. And that's something that I've chosen to do because I want client loyalty. But even at 40% off, they're still expensive. And most of my clients don't have one thing done. They have 3 or 4 or 5 areas done at once. So it's pretty expensive. So I have serious clients that, you know, because, I mean, you know, I just don't want complications. You know, it's hard enough doing business in this world. So that's my take on it. You know, and you know, people will call and say, oh, they saw it on Groupon. I said, well, good, go. You know what I mean? This is me doing it. This is my license. This is my practice. This is who I am. You're also getting my expertise. The dogs may bark because somebody stopped outside, just so you know. They're getting my expertise, my 30 years of expertise, right? And I love doing it. So, you know, sorry, you need to pay for that, right? So that's just my personal opinion. So I'm going to stop the share now, and I'm going to get Josh back on but I'm going to go and get my paper and a pen. Josh, are you there?
I'm here.
Okay, I need to go get a paper and a pen because I need to do some drawing. So just you chat to them for a minute.
All right, sounds good. So I hope everybody has learned something today about plasma lift. And I know there was already some Q&A, so I'm going to go in there and answer some questions. The first one that I think I already know the answer to, and somebody already asked, is the pigmentation issue with the darker Fitzpatricks. So the reason that we don't do that is because the heat can cause additional pigmentation issues, especially in Fitzpatrick's 4 and 5 and onward, because it does, you know, that pigmentation, that highly packed pigmentation makes skin more sensitive to things like this. So you do want to avoid it. So that's the answer to that question that I already knew. So just FYI on that one, you definitely want to make sure that you're doing this on your 1, 2s, and 3s, and usually not past that. And we already talked about how much we would charge for a service like this. It can vary, but it is something that you're going to want to make sure is considered a luxury service, and you definitely want to market it as such because you can get some great revenue out of this. The ROI is fantastic on this because the initial investment is fairly low considering the value that the customer does perceive when they see the results, when they see the research and how it works. And here's Elaine's paper and pen.
Yeah, so I do a mug shot. So I get the client to hold up, and when I do treatments, they hold up the mug shot. I take a picture from the side, and I take a picture of the area. So that's what I do. I wanted to show you my mug shot. Okay, and so that way there's no discrepancy of when the picture was taken for the before and after. Okay,
someone just asked, how much is the class and what dates are you offering the class?
Okay, so Josh, we were figuring out the best way to do it. My best day for teaching is Thursdays, okay? And I do it at Esthétique because and I do one-on-one. So I don't know whether we were talking about it with Asha, whether we created a service on Forest or for Esthétique, or whether we just do it but the bottom line, I do it on Thursdays. So I guess we'll come up with the idea how to do this. For plasma lift, I charge $1,000 for a one-on-one training for a full day. I tell you where to buy the pen and the needles and all of that. So I have researched everything, and you just go and buy it, but you use my device for the training and all that, and I tell you where to get the numbing and everything that. And I tell you where to get all the economical things. So that's the plasma lift. The microneedling, also Thursdays, it's a half day, it's $295. The same with dermaplaning. It's a half day, it's $295. So Josh and I will figure out a best way to do this, just an easy way for you to book it. And it may just be a service instead of a whole story. Just because I feel safer right now just teaching one-on-one than a class, quite frankly. And I'm happy to do it. Vitamin C, as long as it's not ascorbic acid, if it's a MAP or a SAP. Okay, so let me go with my dots now. I'm going to do some dots for you guys. Because, aren't you impressed with my PowerPoint? Did it myself, but I couldn't figure out how to make it.
I was like, look at her with the design and the editing, very fancy.
I couldn't figure out how to do dots. So I was like, you know what, I'm going to draw the dots for you guys. Okay, so that wasn't a very good dot. Okay. So Okay, so it really wouldn't be this wide apart, but just to show you, how am I going where's the camera? Can you see my dots? No.
Move it over, move it over. You gotta cover your face for us to see it.
Oh, I see.
There you go. Now we can kind of see them.
So then you carry on kind of like if you've ever played cards. It's kind of fun. Then you carry on with, can you see my dots?
Yes, so basically almost like a triangle pattern in a way.
Yeah, kind of like, you know, when you play cards. Okay, and then okay, so here's my wrinkle. There's my wrinkle. Can you see my wrinkle?
Yes, it's in red.
Yes, wrinkles in red, righted in red. And I'm going to do my dots either side. You can do 2 to 3 rows. If it's a very deep righted, I would do 3 rows, quite frankly speaking. And I love doing it. I get so into it, and the poor client is like dying of pain. I'm like, are you in pain? I forget that the client is there because I go into my zone. It's kind of funny. It's not really that funny.
So while you're drawing, Maria has a question. She asks, what are some other options for darker Fitzpatrick skin if they can't use the plasma pen?
Well, what is their concern? That's what I want to see. Okay, there's the wrinkle. Because darker skin don't seem to have like my skin sags like crazy. Is that, can you see my lines?
Yep, I can see your dots around the wrinkle. Yep.
Right, thank you. And then the spray method is when you spray. That's for removing skin tags and for hyperpigmentation. So what would a 4, 5, or 6 concern be?
Sagging and wrinkles is the concern, says the
Really? Microcurrent, microneedling, chemical peels. Those are good.
Yeah. And then I think you may have covered this, but someone anonymous, they may have entered after you covered it, but what type of license do you need to do this procedure?
Yeah, I always talk about in the beginning. So I have my esthetician license, but obviously I have medical insurance and I have a medical director. There is no license for this right now because it's so new. I'm sure the boards will come up with, or they haven't said we can use it and they haven't said we haven't used it because they may not be aware of it, right? Of course, overseas estheticians are doing it. So that's, and I have insurance for it.
All right, I think that's all the questions for now. So oh wait, one just popped up. Let's see what it is. Spraying method. Oh, they said they're sorry. They're asking about the spraying method.
The spray method, so what I do is, like, say you have a skin tag, and I don't have any skin tags to show you, but you know.
I have some, but I can't show them.
Oh, I know. I forgot that I did the plasma lift on you because I was going through all the pictures. And did I do plasma lift on you?
A very small section, like right here.
Yeah, because I saw me doing it on you because I was going through all the pictures. Like, I forgot I did it on.
That was like the first day we got the pen. I forgot about it myself, honestly.
Anyway.
So the person asking with the spray method, are you not creating dots?
Creating what?
So they're asking with the spray method, are you not creating the dots? You're just creating lines? Because when you drew
it's almost like you're using a magic marker. You're doing this. So what I do is I take a tweezer or something that I can hold the skin tag, because you've got to cut the skin tag off. And then with the spray method, I'm just working on the hyperpigmentation, like an eraser. Yeah, like an eraser.
Got it. Okay. And then, yes, you do have to be certified to do this. You at least have to have your esthetician license to have this done in a medical professional for your insurance purposes. So yes, you can't just go out there and buy a plasma pen and do this on your friends. Please don't do that. We would not recommend doing that. That's all from me, so I'll let Elaine close us out.
I loved hanging out with you again. Thank you so much for joining us and for taking the time to learn. I hope that you use this knowledge, and I look forward to seeing you again, and I wish you all the success in the world. I know that you're laying a fabulous foundation for the future, and Elaine Sulling Skincare and Elaine Sulling Institute are here to support you every step of the way.
All right, bye everybody.
Bye, love ya, bye.